Thank you guys for participating. We had over like 160 something questions submitted, and that's not even counting a lot of them that were still submitted to my direct messages. First and foremost, some questions I wasn't able to answer because it did establish like a doctor-patient relationship. Those questions are usually more personal, based on prior surgeries or things that you're kind of contemplating and doing on yourself. The only way I can answer those questions is through a consultation to establish that relationship. So I'm sorry I can't take care of that for you, on this platform as well. Also, there were a couple other questions submitted in the DMs that I wanted to go ahead and address, so we don't have to worry about them anymore. Is that we will not be doing a gray sweatpants challenge or gray scrub challenge. That's out of the question. I will not be making a OnlyFans page. That was pretty common, a common question anyway. But moving on, so I kind of broke these up into procedures and kind of like background questions. So because there were so many questions, I'm just going to break it down into like procedural type plastic surgery questions. And then the next video will be kind of on some talking about my background, like major and stuff like that. I will be doing a live event with Réseau Docteur pretty soon. I'll definitely let you guys know about that, and a lot of those questions will be answered there too. So one of the first questions was dealing with liposuction, and can liposuction be done after weight loss, and what are the long-term results. Long-term results with liposuction are pretty well if you continue with that same caloric intake, or you're kind of still eating the same thing. If you start eating massive amounts of calories and stuff like that, of course you're going to build back up that fat. In regards to weight loss, it depends. If you just have more skin or skin laxity versus actual fat, then liposuction isn't a good procedure for you, because liposuction takes care of deep fat. There's like two layers of fat: superficial fat and deep fat, and liposuction takes care of that deeper layer, so you can avoid having any kind of contour deformities or kind of like divots in your skin. That's what you don't want when you're doing liposuction. So liposuction typically isn't done on very small patients that don't have a lot of fat. How do we schedule a consultation? So I work for Holzer Health System in Gallipolis, Ohio, which is in Southeast Ohio. My practice base is approximately 70% reconstructive, 30% cosmetic. And that's just based on, the needs of the community. I'll post my office number if anyone is interested at the end of this video, and I'll also have it in my bio. Is there any part of the body I wouldn't recommend getting plastic surgery on? So that's more individualized. I mean, I can't really tell you that, getting your breasts done in any type of procedure is going to be different from getting your belly or thighs or something done. It just depends on you and your goals and expectations. My perspective on skin grafting. So I'm not really sure exactly what they're asking, but skin grafting is a very useful tool in the plastic surgeon's armamentarium in regards to reconstruction. It's like a bread and butter thing that we do. It's very successful, can have really good results. So, can you perform a tummy tuck after a C-section for single recovery? That's a little bit more personalized. I don't think it's admirable to undergo that type of prolonged surgery after delivering a child. I think you should focus more on the blessing that you were just blessed with, and recovering from that. The body's going to change drastically within that year to year and a half after you've had a child. So personally, I believe it's just better to wait. But like I say, you should consult your local plastic surgeon and go from there. But I feel like your body's going to continue to change over that time, especially if you're breastfeeding, the amount of calories you're eating, your body goals and things like that. So it's just highly variable. But I feel like you should just enjoy the moment with your new child and, worry about, surgery later. Is it recommended to get plastic surgery after a lumpectomy? So a lumpectomy is when you have a very small focus of breast cancer that you can have removed and usually undergo some type of radiation therapy. It depends. It just depends on your goals. A lot of lumpectomy scars heal real nicely and you don't really need a full-blown reconstruction. So it really just depends on your expectations. One of the main reasons for having a lumpectomy is to avoid any type of massive reconstruction. So, it just depends on the individual. Do I ever feel bad for patients that want extra large breasts or oversized, but knowing that they will look a mess, but you still give them what they asked for? So for cosmetic procedures like that, I only perform procedures that I feel like it's going to meet that patient's expectations and that I feel are safe and admirable. So I'm not going to take a patient to the operating room and do something that I feel like is not ethical. That's against my morals, and I'm not trying to hurt anybody either. If I feel like that I can't meet their expectations, then I happily refer those patients to another plastic surgeon, and I'll let them know. I'll be honest with them. How to get rid of dark or sunspots. Usually you can use over-the-counter cream or prescribed cream that usually has something called hydroquinone in it. It's a skin bleaching agent that helps with dark spots, but you should consult your local dermatologist or plastic surgeon to see what your options are in regards to that. What is the right age to begin Botox treatment? It's really when you start having fine wrinkles, or the medical term being right. It's the trend now is that you're seeing younger and younger patients get Botox to prevent wrinkles, and I mean it works. It makes the muscles weaker, and so those muscles don't contract as hard to cause those wrinkles. What are some of the adverse effects of Botox if someone starts too early? Not really any adverse effects. However, if you go to someone that's not very familiar with different injection techniques, you can cause somebody to have like a brow ptosis or a sagging brow where the brow kind of hangs low like this. And, luckily Botox is temporary. It usually lasts 3 to 4 months, but there's ways of slightly correcting that until the Botox completely leaves your system. Let's see. What are some of the steps needed to perform a successful tummy tuck? So I think just continue your weight loss, continue to work out, build up your cardiovascular system, continue to eat or have good nutrition, high protein that has been known to help with wound healing. I think really the only things you can really do, just have a successful successful mindset that everything's going to go just fine, and I think it should be great. So those are most of the procedural type plastic surgery questions. I'll release another post in regards to educational or mentoring type questions. A lot of those will probably be answered during the live session that I have scheduled with Result Doctora, which I'll definitely let you guys know about. Check out the end of the video. I'll leave my office number for consultations and things like that. I hope this was helpful. I'm sorry that I couldn't answer everybody's questions because they were a little bit more personal, and I can't establish that relationship outside of the office just from a medical legal standpoint and also ethical standpoint. So thank you guys for tuning in. Can't wait to do this again. I will definitely let you guys know when I'll be accepting more questions for the next question and answer session. And like I said, continue to have a good week, continue to stay safe, and always mask on. You guys have a great night.